Welcome to Future Minority Dentist Club on Clubhouse. My name is Paula Benefo. I'm a rising D1 at the University of California, San Francisco. Thank you all for joining us for this vital conversation about racism in dental school. So how we wanted to format this was really to have, if there are any dentists or dental students who are listening in the audience, we really actually would like to change the format of this and actually have you interact with the speakers on stage. So if Kenneth, I don't know if you know how to, but if you could make everyone, Dr. Wilson and Dr. Jackson and I, moderators, that would be really helpful. So then I can help bring everyone on stage. I really want this to be more of a community discussion. And additionally, how we'll kind of structure the room is we'll start with the grievances and experiences, and then the later half of our discussion, we will really just direct it into what are our asks and how to really resolve some of these issues that we are seeing. So Kenneth, you're the only one who's a moderator currently. I think it's because you started the room. So if you could make Dr. Wilson, Jackson, and I moderators, that'd be great.
Yeah, so I'm unfamiliar with how it works. Do you know how?
Yeah. So what you'll do is press each of our photos, and then what you can see on your side is there should be an option on the lower half to say make a moderator. Yep.
Okay, awesome.
Awesome. Okay, so I'm just going to invite Dr. Phillip up, and then if anyone else, please just raise your hand and I'll just invite you to speak as well. Okay. Okay, so then I'm just going to hand it over to Dr. Jackson and Kenneth and Dr. Wilson to just introduce yourselves, and we'll just kind of go around the room and really just have a community discussion. So, yes. We can start off with Dr. Jackson if you don't mind.
That's fun. I didn't want to overstep anything. Hi, everybody. My name is Dr. Marie Jackson. I'm a general dentist practicing in Montclair, New Jersey. I'm also the owner of Stellar Smile Center. I attended dental school at what was UMDNJ, New Jersey Dental School, but what is now Rutgers School of Dental Medicine, and I graduated in 2008. I attended a residency from 2008 to 2009 at JFK Medical Center in Edison, New Jersey. And but I'm a GP, or general practitioner, and I'm definitely happy to share some of my experiences from dental school with you guys when we get there.
I can go next if you want. Hi, everybody. I'm Dr. Lori Wilson, and I'm a frequent flyer with the Black dental students and pre-dental students. I'm a general dentist. I attended undergrad at Florida A&M, Rattler from Florida, and I went to Meharry Medical College in Nashville, Tennessee. So I am a Meharian, and I do practice public health dentistry at this point. And also on the side, I do forensic dentistry. I actually went to McGill Faculty of Dentistry in Montreal, Canada, and did a forensic certificate. So I do forensic dentistry on the side.
Nice. My name is Kenneth Glenn. I'm a third-year dental student at UCLA. I went to undergrad back in South Carolina, a small school called USC Aiken. And pleasure to be up here with you guys.
I'm Dr. Philip Sadler. I'm a dentist, general dentist here in Berkeley, California. Been practicing 30 plus years. I'm a graduate of Morehouse undergrad and Howard University College of Dentistry. And I'm looking forward to talking with you guys in reference to learning about what's going on in a dental school or dental schools, yeah, and also let you know that and be very honest with you, it doesn't stop there. I mean, it's there's stuff out that here. I've been practicing 30 years, and it still goes on with some of the challenges with racism in dentistry itself. So not just dental school, in dentistry itself. So I can share some experiences I've had with some of the local dental societies and how they treat African American, or I should say African American, how they treat minority dentists versus other dentists, and how the bar is things are treated. I mean, the bar is different, and you'll be anyway. We'll talk more about it, but I'm going to take it from the stage, and we'll see how things work out. Thank you.
Thank you. I would like Ariana to introduce herself if she is actually available to speak. If not, then I'll have Mitzi speak and then Dr. Walt.
Hi, everyone. I'm an incoming D1 at the UCLA School of Dentistry. I went to undergrad at Xavier University in New Orleans, and I'm really looking forward to this conversation, and it's nice to meet everyone.
Hi, my name is Dr. Mitzi Liu. I graduated in 2015 from Tufts, and then I was in the Navy for 5 years. And right now I'm doing an orthodontic preceptorship at UCSF, and I'll be applying for residency this summer.
Hello, everybody. My name is Dr. Walter Rock. I'm a periodontist in the Houston area. I've had the opportunity to moderate and be a guest for this group, and honestly, it's a wonderful group, and I'm really looking forward to this discussion.
Wonderful. So I'm going to just open the floor and just really just allow us to really have an honest conversation. And then I'll share some of the stories that were submitted on our Instagram or DM'd direct messages on Instagram of dental students who are not able to join Clubhouse currently, of their experiences in dental school. So anyone can just take off the floor. Just please be aware that we hold a policy of one mic, so try to not to overlap each other as much as possible, but I give everyone free reign. Thank you.
Anyone, please, I know you have a mic, but please feel free to cut me off because I'm a talker. I will definitely give you guys some insight to my experience in dental school. Prior to dental school, I went to undergrad at NJIT, New Jersey Institute of Technology. It was an extremely diverse school. I was an engineering major there, and I had like every person, every color, all over the world, like in classes with me, and I loved being in that environment. So I went from there to what is now Rutgers School of Medicine, and at the time, in my class, I started off one of 4 black students. There were 2 girls, well, 2 women, 2 men, and my classmate, she left after the first semester because she decided to actually pursue medicine and did not feel dentistry was the best fit for her. So I want you guys to keep in mind, I was, again, the only black girl in my class. So each class year, we had assigned scrub colors to us. So my class year was this ugly seafoam green, looked terrible on my skin, but all the other class years had blue scrubs, either like a bright blue, navy blue, or sky blue. And so what that meant was I was in the entire student body, I was the only black girl in green. So I was easily identifiable to the point where today I still have colleagues who will call me about a mutual patient who may be a little bit further out from where I practice, and I have no idea who they are. They're like, oh, I remember you. So I was definitely a person who, I guess, in a sense, stood out from the crowd. So in my experience, I was hyper aware of being easily identifiable. So I made sure I never, ever missed class, except for one time when I was extremely ill, so I had to leave school early that day. So once in 4 years. And I remember the next day, everyone, all professors, like, are you okay, this and that, because they knew I wasn't there. So that's something that was, I was hyper aware of. When we took exams, I always sat in front of the classes. I didn't want to hear anything about that girl, the black girl in green, But that's just some of my experience. And I will say a lot of schools, especially, not HBCU, dental schools. There's only 2 out there in the nation. The numbers are abysmal. We're about, I think, 3% of all dentists are Black. And, so the student body reflects that. And I will say to students who are in dental school now or incoming into dental school or looking at dental school, it is extremely important to make sure you find a support. And I mean that with other students in school, be it upperclassmen, another classmate, support amongst family and or friends outside of school. They may not understand what's going on, but you want to make sure you're supported. And also, a faculty member. They don't necessarily have to be a person of color, but you want to make sure they understand certain issues and are there supporting you. So that's definitely a big piece of advice I'd give to any students going in. And if you're in a predominantly white institution, you want to look for an SNDA or another student body group, especially with SNDA, who will be there with really the sole purpose of supporting, minority students. That is what they exist for. I definitely found a home in that, and I still have friends from that group to this day.
For me, University of Pittsburgh was where I went to dental school. In undergrad, I didn't feel like so much of a minority because we had the Black Action Society in Pittsburgh. Actually, I went to University of Pittsburgh for undergrad and then the dental school, and it's just amazing to me to see the difference. And one thing that I started noticing as I progressed along my academic career was the higher I went. Right, you went from Bio 1 to Bio 2. Bio 2, maybe you took biochem or whatever it may have been. You started noticing less and less of us, and it wasn't until I got to Pitt dental school that I actually noticed that I was literally the only Black guy in the school. And it was like every other year they would have a Black student, and it was just one of those things that just really amazed me. There were 2 other colleagues of mine who were also Black, but they were Black females. So we had in my class we had 2 Black females and then me, the Black guy. Dr. Jackson, it's sad for me to think of how much you had to go through to almost, you almost had to go out of your way and to be perfect. And I just don't understand. And that still frustrates me to this day that we always have to kind of be perfect in order to feel like we're going to fit in, or we don't want to make a mistake, or we have to represent the whole population. And that kind of pressure is unnecessary, especially when you have so many other academic pressure that's on you as a dental student. And to feel like you have to do this, you have to go above and beyond. To me, it's unrealistic, and it's not fair, and it's not right. But yeah, I mean, Dr. Jackson, you're not kidding when you say that this is something that you have to think about every single time, right? Because you don't want to come off as the angry Black kid, or you don't want to come off as the lazy Black this and that. I had a classmate of mine who asked me, "Oh, well, you got in because of affirmative action, right?" Not knowing my grades, not knowing anything about me. This was my freshman year, first semester. And I know for sure that, he didn't mean anything by it, but it was one of those things that really caught me off guard. And anybody that knows me knows that I'm very vocal about a lot of things. So I had to correct him immediately. But it's something, again, why do I need to deal with that? Why do we need to deal with that? And that's something that I hope to kind of speak about as the night progresses. And I hope that, if anything, I can get across the fact that there's too much pressure on you students for you to be having to, think, okay, now I have to be perfect on top of that. And it's not fair, and it's not right. And I hope to kind of bring that to the light and have a deeper discussion about that.
Well, I'm hoping tonight that we kind of really listen to the dental students that are currently in dental school, and can talk to us about some of the experiences that they're having. Because I'm just going to be honest with you, I don't know what to tell you. I have no idea what to tell you, what to express to you, how you're going to deal with it. Because, like Dr. Phillips said, it doesn't stop there. It continues. It continues in your career. You're going to have people who do these microaggressions every day to you on these jobs. And the comments that they make, there's almost like paper cuts. You know how paper cuts hurt? It may be a little small paper cut, but it hurts. And there's so many people that want to undermine you and want to say you don't know what you're talking about, or they don't give you credence to the title that you hold. And, the only thing I can tell you is that, I just want to be supportive of the dental students and dental school. But I got to tell you the truth. And the truth of the matter is that this continues. It continues. And the only thing that you can do is figure out how you're going to respond to it, because people are not going to respect you for being that doctor. They're going to see your color first. And that's so unfortunate, but it's something that is going to occur. So, I don't want to sugarcoat nothing. I tell my mentees all the time that I mentor, I got to tell you the truth about this profession. And you're going to have to be determined, how you're going to deal with the racism. Because it's going to hit you in your face every time, and it's hurtful. And years of experiencing this, you do become angry, you do become paranoid, but there has to be another way for you to release that. And the only thing I can tell you is that you're going to be able to I think we talked about this before, you're going to have to be able to, what is good for you and how you're going to respond to it. And you're going to have to be a fighter. Sometimes you get tired of fighting. You get tired of trying to, you hate that people judge you from the color of your skin, but that's going to happen. And so I just try to, encourage my students now to, have like Dr. Marie was saying, have a support system. Somebody who's going to support you and that's going to know what you're going through. I do recommend a person of color to be your mentor or be your advisor, because you want to talk to somebody that can experience or can relate to some of the things that you're going to go through. You don't want to have to explain to somebody about something, what happened. Or, I wrote a book called Black Women Dentists, and one of the dentists in the book, she was an endodontist, and she was like the first Black woman to attend University of Oklahoma Dental School. And she talks about this story in which she cut a prep. Well, she knew that, she was the only Black girl in the whole school, and she knew that one of the white women instructors didn't like her. So she had some friends that were white males, dental students, and she told them about it. They were friends. And they was like, oh no, the lady's that faculty member is fine. And she said, okay, well, let's do this experiment. So she took one of their preps, which they got an A on, and she put it in her valet for the instructor to come over. The same prep that her dental colleague or dental student got an A on, the woman promptly gave her a C. So she knew then what she was dealing with. So what I'm saying is that you're going to have to find in your arsenal someone who's going to be supportive of you and your matriculation to dental school, through dental school. But I don't want you to think that it stops there. The one thing about me the best thing that happened to me at Meharry was that Meharry informed us of this early on. So we had a dress code. You couldn't come to clinic unless you were dressed. The men had to wear ties. And, they did all of that back in the day. So because, we're just trying to train you to a certain point so you can understand who you are. So once you leave here and you face all this aggression, you are already undergirded, because you spent 4 years with people actually encouraging you, saying, I'm Black and I'm proud, making you understand that. So, I didn't have that in dental school, but I definitely was taught about what to do. So, all I can say is I really would like to hear from some of the dental students tonight so we can understand what you're going through, so we can support you in it. But I just want to, kind of inform you, it doesn't stop. And I just want you to be encouraged and try to make it to the next episode, because there's going to be an episode. It's going to hurt you, but you're going to have to be able to have in your arsenal what you're going to say. And you need to go ahead and call it out then, because all it does is build up on you, makes you paranoid. It makes you not really trust people. And you don't want that in life. You want to have a successful career. So you're going to have to find an outlet or someone to talk to, because people are going to do you like that. The dental assistants would rather have a white doctor. They don't want a black man or a black woman tell them anything. That's just how it is. And I am Dr. Wilson, and I yield the mic.
Hey, thank you, Dr. Wilson. I'll tell like a story that happened to me. I think it was last year at this point. In our clinic, and probably a lot of clinics, call the group practice. And at the moment, they aren't like physically in the clinic. So if you get something treatment planned in the clinic, you have to go to their office, later that day, ideally, or the next day, and then they'll approve it without having seen the patient. So the notes you take are really important before they can approve something that they never saw. And so there was like one point when I was like new into clinic, my notes are on the wrong type of form. And then I accepted that. I'm like, okay, it's like a personal mistake. I won't let it happen again. And I didn't. The next time I had that particular treatment planning appointment, I put the perio in this proper form and I put the restorative in this other form. Okay. I go to see the guy, and he's looking at the form that you should look at for perio things for something restorative that I needed him to correct. And I was like, no, sir, it's in the treatment planning considerations form. And he's scrolling the consult one form because I just don't see it. I don't see it. And then I think my fourth year was there. He goes, he's like referring to the fourth year. He's like, whatever his name is, you got to get your little brother in line. I'm like, this dude's not related to me. He's not my brother. It was just a really weird moment. And then I had to interject. I go, sir, you're I don't know if you mean to do it, but you're looking at the wrong form, if I may. And then I clicked over and there were the correct notes. He goes, oh, okay, I see. And yeah, it's been weird ever since then. Like, I don't know what prompted him to call me, like my fourth year's little brother. And, was he waiting to say something like that? It's been really strange. So they're changing how the clinic is set up in July. So hopefully things will be, more straightforward. But like currently, ever since that happened last year, I've been feeling like, I feel like undue pressure to have my notes, like very meticulously placed and all my ducks in a row before I see this guy. And really, I feel like we should have a normal, boss employee relationship. But now I feel like I'm on pins and needles because I don't know what he truly thinks of me, like since that moment. So to all the pre-dents, just make sure all your ducks are in a row, and because you never know what someone may be thinking about you.
Kenneth, I'm sorry you had to go through that. And I have to echo what Dr. Walt said earlier, where it is not fair where students have to go through that. I will say this, as a dental student, regardless of your background, I do think being detailed, like you mentioned, is important. But I will say this to you, Kenneth, what other people think of you is none of your business. I think you need to focus on doing your work well. And of course, yes, it's easier for me to stay on the other side because I'm finished with dental school. But all you can do is focus on doing a good job. And the reason I said that is because there are some, I'm going to probably get in trouble for saying this, I don't care. This is what it is. If it goes out there and it's recorded, there are some dental professors who are senile. Just straight up, they're senile. Some of them are 11 million years old. And some of them are they're coming to dental school as a retirement option for them. And they are not functional. So, I had professors there was a professor who pinched a girl's butt, another one who commented on some girls' looks, all types of crazy stuff like that. So they were legitimately senile as far as I'm concerned. And there may be some people who are undiagnosed in the school setting. And I'm sure many of the dentists and some of the students can attest there were a lot of older professors. And it's not to discriminate against old. It's just reality is some of them are coming from a different background where they went to dental school when there were very few to even less Black students or less students of color. There were plenty of classes that had no women at all from the time some of my professors were in school. I had a professor who graduated dental school. My father was born 1955. My father's 65 years old now, So it is a different demographic, and you don't know what they're thinking. But I think the focus on just doing things well and being the best you can be is all you can do. You will never know what's in someone's head. They may hate your guts. They may not. They may love you. They might just be nasty to everyone, but you cannot spend your time worrying about that. I think your concern needs to be more of what your work is than anything. And just put your head down and get up out that place. That's the best way I can describe it. And I hate that so many of us had to go through that in PWIs. For those who don't know, PWIs are predominantly white institutions. At least every one of my colleagues of mine who are in dentistry who went to PWIs, we all did that. Let's just get through. The focus was just getting through, and you are going to encounter some crazies. And I definitely had professors say straight up to me, you don't belong here. I'm like, huh? Me? 3.7 engineering degree? Nah. And this is, so I guess this person said what he thought, and I still couldn't I couldn't focus on it because you just got to kind of keep moving. I hate that. I hate saying it and trying to make it so simple, but you can't. The guy is a jerk, and you write him off as a jerk, but you still have to deal with him in terms of what it is, and that's going to be out there in the real world too. Just like what Dr. Wilson had said earlier, you're going to encounter some wacky stuff in the real world. You cannot let it. You can't let the opinions of others wear at you. Just do what you got to do.
So I'm also going to share what we received on Instagram, and this is from Hani Loco, and she submitted. I don't know if this counts, but when healthy gingiva is presented in our clinical lectures, they always appear being pink, but it's written in parentheses that gingiva can appear dark, can be darker in darker skinned people, but all the pictures are in pink gingiva, and darker gingiva are always depicted as unhealthy. And so that was her statement. I don't know if anyone has feedback or has experienced that and can say something to that.
Yeah, I can. That's stupid. Let me just start off by say that's dumb. That's pigmented gingiva. That happens in Middle Easterns. That happens in African Americans. That happens. I've had patients come to me saying, especially Middle Eastern patients of mine who have had little kids, saying, "Hey, can we get rid of this?" And that's just something that I think we all have to kind of work through when it comes to, darker may not necessarily be appealing to certain classes and races and so forth. But overall, health. I mean, I have pigmented gingiva, and I have like 2s and 3s in my mouth when you probe. So health does not equal color. I mean, there are some melanomas that may occur, but that's, again, being educated shows you that there's a difference between health and pathology. So again, I'm sorry that they feel that they had to kind of at least listen to whoever was lecturing, but that was completely ignorant. And it makes no sense at all. If that's all they have are 1 or 2 slides that show healthy gingiva being pink, then they just didn't do any research whatsoever or haven't encountered people that are outside the the white race or whatever it may be. I don't even know what to say. I'm just irritated by just listening to that because as a periodontist, I mean, we see so many different varieties of gingiva, and I don't know. That's annoying. All right, I'm sorry.
Don't, Dr. Wall, please don't be sorry. I'm going to add to that. So I actually get asked about that all the time from patients. Now, if you guys click on my picture and you go to my Instagram page, it's my office page, I have a series of different videos, and one of them is colors of gums. I got asked that question for some reason, like 4 times in a week. Like, is this normal? And in the past, before COVID, I would pull down my own lips and like, look at my gums. My gums are healthy. I'm in good shape. I get checked every 6 months. I'm extremely meticulous with my home care. These are healthy gums. This is normal. And I actually addressed it in the video because I was asked so often about this. This issue that the student brings up isn't unique to dentistry. There's actually somebody online, I forgot who it is, who has an Instagram page. And this gentleman put together a book of different dermatological issues and how they look on brown skin, because there is a lack of representation of how things like eczema, etc., show up on brown skin. A lot of those issues that we see, like a lichen planus, there can be skin issues, show up in the mouth as well, and they do present differently in people of color. I'm in a very diverse area, so I do get questions, and I see people of all different colors in my area, and I get asked about. I even get asked. I don't know if you've been asked about this, Dr. Walt, about like there is some type of, I guess, procedure that people do with like laser to whiten or lighten their gums, and I'm like, I ain't doing it. But it's just basically another form of colorism, but it's an issue throughout not just dentistry, but the medical community. What's healthy and what's pathologic isn't necessarily shown on different colors. So it's,
yeah. Sorry, no, I actually have had multiple people come to me saying, hey, can you lighten my gums and just remove this? And, it's just a matter of just explaining to people, like, melanocytes are within certain levels. There's 5 different levels. And I'm not trying to go in depth, but there's 5 different levels when it comes to skin levels, right? And within the second and third levels where, like, the pigmented cells live, and so all you have to do is literally take your diamond burr or whatever and just remove that top 2 layers, and you'll be able to have gums that once they heal, they turn pink. And now you've gotten rid of the pigmented cells within that gingiva. So it's very easy to do. But have I done it? No, I absolutely refuse to do that. I explained to my patients, and again, I've had multiple people, especially Middle Easterns, and I'm not trying to insult anybody who's Middle Eastern and think that this is just them. It's everybody who have come to me and said, hey, can you remove this from my kid or whatever it may be? And I explained to them that's completely normal. I have it. It does not mean that it's bad. It's just who they are. And once you explain that, most people go, oh, okay. I thought this was actually bad then. And I know it's not at all. It's completely normal. And once I do that, I haven't had much of a pushback, but it is something that I've been asked to do multiple times.
Okay, I'm going to share the next one. Actually, in the last discussion we had regarding racism in dental school, a student talked about how their braids that they had in their hair was unprofessional. One of the clinic professors had said that the braids that they had in their hair was unprofessional, and to actually remove it for the next session, I guess their next rotation. But this story is actually oddly, in a way, the opposite of that. This is a student who is the only Black student in their class, and she had braids in her hair and she had beads, I guess, at the tail ends of the front 2. And I guess at the beginning of the lecture, the professor, had complimented her hair, and then subsequently, I think after the lecture, came up and touched her hair and her beads, and just asked, like, how do you get your hair to be in this style? How are you able to add the beads while subsequently just touching her hair? And she recounts how she froze and she just stood still and was nodding at the professor, and had her friends kind of come after, like, are you okay? But that was her experience that she had shared with us. What would you guys say in response to this?
She should have touched her hair back. Let me stop. But that was my first thought. Like, it's unfortunate. I think as a society, I think people put, especially Black people, especially Black women, and like objectify them in a sense where they're other. And, because this other and objectifying, people feel like they have the right to touch someone's hair. It's not appropriate. It is rude. And I wish I had a better answer for her other than just go ahead and touch her hair back. It could only be done in that moment, but it's also not a professional response. But I don't know what to say. I don't know if anyone else has something to say with that.
I think at this point, I really do think that Dunn School should definitely be into what is it, diversity and inclusion type of programs. They need to educate people because that is offensive. It's very offensive to give your opinion about somebody's hairstyle in any type of I guess, clinical area or professional setting. I think it's very offensive. And I think that more dental schools are going to have to stop. They're going to have to start having these trainings in which they're going to have these diversity inclusion type trainings, because if not, they're going to get sued. You touching somebody's hair and commenting on their hairstyle, whatever. That's something that does not need. That shouldn't be allowed in a teaching atmosphere. That should not even be part of the conversation. I do know that we've had people say, one of the students told me that one of their professors in the pedo clinic, when they're doing a rotation, commented on her ethnic earrings. And I told her, well, I'll tell you what, since you're trying to get this grade, don't wear those to the clinic. Just wear something that may be, a little bit more non-noticeable, because when people start, actually calling you out or looking at this and making a conversation about your outer appearance, I don't think that's a good thing, especially when you wanting to get a grade from them. So it's unfortunate, but when you're in that type of atmosphere, you have to, like Dr. Marie said, put your head down and continue to do what you need to do, because you do not want someone to single you out. They're going to single you out anyway because you're black and you're different. So what I'm saying is that sometimes this fight, you don't need to fight. There's going to be other stuff that you can make your stance on. But when you see that people are petty like that, then you're going to have to make a decision of how you're going to handle it. And I would not want somebody to touch my hair and not make comments to me about my hair. And but I would definitely encourage somebody to wear a protective style if they wanted to. Black people, black women, we do braids, sometimes for protective style. So I would definitely, yeah, I would definitely encourage, black women to continue to do that. But how you tell people, will listen, or you put your hand up saying, look, please don't touch my hair. To me, I think that's acceptable. You don't want people grabbing on your hair and, making you feel uncomfortable. But I definitely think that dental schools have to start doing this diversity training to everybody so they can understand how offensive that would be, because of course they would want to say, oh, well, I didn't know that offended. Yeah, it does offend me. Don't touch my hair. So I just think that it's on the dental school's part to actually make sure that their people that they have employed understand ethnically and culturally how important it is to keep your hands to yourself and don't touch people.
Oh, I just wanted to invite Dr. Mitzi or Josie as well to speak on any experiences you have had in dental school as well.
Hi everyone, I'm Josie. I'm a third year student and I'm actually from Miami, but I'm studying in Milwaukee. So that was a very big transition culturally. Just like this was the first time that I ever actually felt like a minority, because I'm actually Afro-Cuban. So everyone in Miami, for the most part, is either, Hispanic or something, So coming up here, actually, it was interesting. I think one of our hygienists she really mentioned the fact that she saw I'm one of 3 Black women in our class, and she mentioned that she felt that it was kind of wrong for us to apply lotion while we were in class. And, I'm sure women of color, you can understand how important that is. It gets really, really cold up here. So at no point were we bothering absolutely anyone. At no point were we being disrespectful or not paying attention. But she just went out of her way to let us know that she didn't appreciate that. Another instance I would say was that when in the middle of one of our actual practical exams, there was a different hygienist who came up to me to ask me if I was Indian. And, she would have never done that to any of the other students. Why in the middle of a practical exam do you want to ask me about my race while I'm trying to concentrate to do something? And when I ended up telling her, oh, no, I'm Cuban. And she's like, oh, that's interesting. The color of your palms, your hands. I just felt like the whole conversation was totally uncalled for. And then when I told her that I was Cuban, she's like, oh, I actually went to school with a couple of Cubans. Oh, no, they were Puerto Rican. Yeah, that's what they were. Just little things like that where they're just little microaggressions. I think after that, they did have a little diversity meeting. But, we have so many other stressors in school that we don't need the extra fluff.
Can I just say that I don't believe diversity and inclusion works because people have kind of politicized diversity and inclusion, right? Because they think, oh, well, there's nothing wrong with the way I think, so why am I being forced to learn about diversity or so forth and so forth? So I think unless people are open-minded to actually talking about true issues, it's really just always going to be, well, you're basically saying I'm racist, so I'm going to stop listening to anything that might be beneficial. And again, I'm going to put it out there and ask what other people think. But I've actually seen and read articles, and I'm not sure if it was University of Minnesota or whatever. There was a dental student that actually made a big deal about the fact that they had to take a diversity and inclusion course and sent an email out to the dean, and the dean was about to suspend them. But then the local politicians were like, well, no, you can't do that because now you're basically infringing on his, I guess it was First Amendment right to disagree with you. And then again, it became very political. And I just think that that's the environment that we're in right now. So again, let me know what other people think.
Dr. Well, I agree with you with a lot of that. I actually, myself and a group of other Black alumni from Rutgers spoke one-on-one with the dean this past summer because of incidences and issues that took place at the dental school over the last few years. We had a few documented from students that were there presently. We didn't want any of the students involved because we didn't want to have any issues with retaliation. And we did ask, what is the training currently? And they have something like HR runs at the university. However, it's become akin to if anyone's been for example, where you go to a hospital or a new job or something of the sort, they will have sexual harassment training. So it's kind of like that where people are half paying attention. They're not really very intentional with how they run it. It's run a lot of times out of obligation, and people don't feel they have a need to listen to that. And I think it's just, like I said, it's an obligation for the faculty and staff as opposed to something where they personalize. It's it's not my problem. It's too bad you're being too sensitive type of thing. So these schools do it a lot of times, and they do have, things written down how they do not tolerate racist behavior, etc. But I think their definition of what racist is someone coming in with a KKK hood. They're not going to do that at the school. It's these other issues. It's talking about, even how they interview things, how, other students making comments about affirmative action, things like that. Those are racist in the schools, and the idea of what they think don't recognize what we, in a closed circle, understand and know it to be.
I 100% agree, and I think that when we've had instances in our school when it's like all of a sudden, oh, a diversity training pops up, you know, it kind of puts the students in a weird position too sometimes, because there's literally like 1 to 3 of us in the class. So it's like, okay, who was it? And so then it just gets really uncomfortable. But I agree. I think it's just like a ticking of the box. We did it. Yay for us.
Well, I have a different opinion about that, but I did want Mitzi and Philip to speak because I haven't heard from them tonight. So I'm going to just say this. It worked different for us in Virginia at VCU School of Dentistry. It actually worked different. It actually worked. We had some issues. I mean, well, the dean came out on top of probably last summer because of all this racial unrest, and then the school itself had to look inward about some of the issues that they were having and how they treated the Black students there. But also, you have to understand that we have a strong Black dental society, which I was president of the local component, and I'm president of the national, the state organization. We have very strong Black dental society in the city. Plus, some of our members are adjunct professors there at the school. So the school actually changed and actually required it. I mean, I don't know how else we're going to get out this information to these people to understand that some of those things that they're doing is not acceptable, you know, unless you want to be faced with a lot of EEO lawsuits and complaints. You have to tell people exactly how you want to be treated or what's fair, and that's equitable. And so it worked for VCU School of Dentistry. It really did. So people can understand that, you know, who are protected classes. And then you got to be very careful how you talk to people and how you treat them. And, you know, I was shocked when the dean came out and just automatically embraced that and started looking at how the Black students that have been there, how they have been treated. So I definitely think, I guess you're going to have to look at this on a case-by-case basis, but it definitely worked very well for us because of the support and the stakeholders in the city of all the Black doctors that belong to society and that were donating money. You know, money is the bottom line to the dental school, you know, doing with their endowment and making sure, you know, listen, you know, we're going to give you all this money, but you're not going to mistreat these Black students that go to this school here. Matter of fact, we need to see more in every class. So every year, the dental school comes to our convention, Old Dominion Dental Society convention, and give us a report of the Black students that are in these classes. So we have like an invested interest. And I think, you know, it happened different for us because we made it happen that way. We actually pressured those people to make sure they understand that we're looking and we're seeing and we're watching what you do. And you know what? Our checkbooks and our checks that we're giving, we want to make sure that we are well represented in those classes, and we want to make sure that those students are treated fairly. And so a lot of the Black oral surgeons came up there to the school, and actually, you know, we're able to have a big influence. So like I said, I probably would like to hear Philip talk or Mitzi.
If not,
Sorry, I don't have anything to say. I thought we were all just supposed to join on the room, and so I added myself, but I don't have any. I just wanted to listen to what people had to share.
Okay, well, we know that we have Dr. Chi on stage if he would like to introduce himself and also share anything as well.
Hi, is that me, Dr. Chi?
Yes, sorry. I'm not sure if that's your last name or Dr. Dave.
No, it's fine. David is okay. How are you doing, guys? So yeah, I'm actually a 4th year dental student at NYU. I'll be headed to Yale next year for a GPR. I think the title caught my eye. So I kind of like Mitzi was interested in just hearing what everyone had to say. My headphones were kind of going in and out, so I missed a bit. I'm not sure if there are any specific instances or scenarios which you'd like me to talk about or anything that you'd like me to shed light on. maybe talk about my experience at NYU or.
Well, yeah, any experiences that really pertain to discrimination or racism that you've experienced at NYU, anything that you're willing to share, it's fine.
Okay, yeah, of course. Well, for starters, so NYU is the biggest class, really the biggest dental school in the country. I'm one of 400, but I'm also the only African American male in the class. So you can imagine the kind of things or the kind of experiences that brings. Some days you get. This is by other faculty as well. And I feel like also
I don't think we were able to hear you for a second. If you could just repeat what you said, I think you kind of went blank there.
Yeah, no problem. I think it's because I was getting a call. But yeah, what's it called? So sometimes so I mentioned what's it called. I'm the only African American male in my class of 400 in the largest dental school in the country. And my overall experience was good, right? But there are some days where by other faculty you'll be mistaken for the janitor or the AV guy, which can kind of get a little bit frustrating. Or there are other students who have maybe never come across or never dealt with people outside of their race until they got into those class or they got into the class, and there's certain things that they'll say will kind of be very insensitive. I'm trying to think. There was one day there was a girl actually in the class, and she was sharing a mnemonic that she had made for PCR testing. So I learned it as Snowdrop. That's what everyone else had learned it as Snowdrop. But she took it upon herself to make it something as I think if I remember it, she was saying something like, people in the South rape niggers. And she said this openly to friends in front of me. It was interesting because it's not like you haven't heard these things, but it definitely puts you in an interesting situation being in professional school, because you don't want to not say anything to now show the rest of the people in the room that it's okay, but you also don't want to overreact the way that you might, in your at home or in a personal setting, and all of a sudden you're painted as the angry Black person. That's not what you ever want to be. So I felt while I did have a lot of fun in the last 4 years, there's an element of code switching. There's some grace that you kind of have to give to it. There's some tiptoeing around certain things. Some faculty you can go to about certain things, but granted, I'm the one right in my class. So you can imagine how many faculty we have, and it's not very many. The bonds have to be tighter as a result. But really the focus is kind of just getting in, making your relationships, and getting out, I've always my family has always been if you dwell on the negative, too much, it doesn't do any good for anyone. But not to say that the negative hasn't happened,
She should have been reported, straight up. That's crazy, especially,
Right?
you're in New York City. You're in New York City. Think about the patient population you serve. That's why, even when I would hear things from my classmates or see how they were nasty with the dental assistants who worked at the school, who were mostly Black, it was unacceptable because we were in Newark, New Jersey when I was at Rutgers. So, most of our patient population was Black. So it shows the lack of respect they have for who they are treating. This is unacceptable. And when you are a person who's a dentist, whether you're in private practice at a health center or whatever, you're serving people, and you should not treat people any differently. You should always walk with a level of respect for other humans, regardless of their background, their financial status, whatever. And that shows complete disregard for a whole entire race. And that to me is completely, perfectly, a thing that should be reported.
So what actually happened? So did you report her?
So it was tough because So I'm just gonna go ahead and say no. I didn't.
If you did it, I'm not mad. You're in school. I get it, but I'm not. You know, like just trying to get through. You're trying to get through. Now, if that happens after you finish school, you go ahead and
It's a whole
let it be
different
known.
story now.
Document it. Document it for after you graduate. You document that because these are things they need to hear about because we've done it in my school. Document it, please. Her name, the date, all that, the whole phrase. Write it down. After you graduate, you go ahead and once you get your paper, then you go ahead and let them know.
It was tough, you know. I sought counsel from kind of like the upperclassmen at the time, as well as my friends from home. I wasn't really sure, exactly what to do. I didn't want to report her, and really, my best friend, he's a pastor, and he put it like this, as upsetting as it was for me, he encouraged me to kind of take it or really look at it like a learning experience. This is an example of somebody who's never been around the people that, these words offend. So I took it on myself to just pull her aside and let her know in a, stern but like professional way. If I reported her, not to say that it doesn't deserve to be reported, but what happens? Does she get expelled now? And now because of this, she now ruins her life, and now she has even more reason to hate our people. I don't know. And this could probably be me overthinking.
But that's not your problem. That's not your problem. You don't owe her any loyalty. I mean, like I said before, you're going to have to find, and it's going to take a minute now because I ain't going to sit up here and say it didn't take me a minute. All the microaggressions I faced, during my career, it took me a minute to actually find my own voice. You're gonna have to find your voice, and that's something that you shouldn't even have to endure. I mean, it's definitely what we call PTSD that you're suffering from that and being exposed to that. I tell everybody all the time: have you checked on your Black friend lately? Because of the mental health that we have to endure, some of these things that occur, and you're going to have to find your own voice. It's going to take a minute to develop that, but you're going to find it, bro. You're going to find your own voice, and when people talk crazy to you like that, you don't owe them any loyalty because you know what? She should have been very careful of what came out of her mouth. You don't have to feel guilty or feel like you owe her anything. You know what? That's not your journey. But what you're going to have to do is you're going to have to find your own voice, and you can develop that. It took me a minute to develop it. I'm going to just be honest with you. Some crazy stuff has been said to me during my residency and even in practice. So what I'm saying is that, find your own voice so you can be able to, kind of tell people exactly what's on your mind, but like you said, in a very professional way, so they know that, listen, I'm not even going to try him because I know he's not tolerant of that. And like I said, you don't owe her any loyalty because that shouldn't have came out. Now, why is it that you as a Black person, me as a Black person, we know what to say to people, we know not what not to say to people, right? Well, how come we've been raised like that and they haven't? So what I'm saying is that I just want you to be encouraged and understand you don't owe her any loyalty because that shouldn't have occurred, and that should not make you feel some kind of way because this woman said that to you. I mean, it's really egregious, that you even have to even say that's part of your experience, to be honest with you.
True, and I
appreciate that. Can I say something real quick? I'm listening to this conversation and I'm confused right now because now it sounds like we have two double standards here. Initially, we were talking about how if professors were touching your hair or saying outrageous things to you, you just put your head down and just graduate. Now we're saying if it's a classmate of yours, now all of a sudden you have to get rowdy and show your voice and stuff. And I think it's kind of giving us two mixed signals here. I think, to me personally, no matter who it is, you got to go to somebody that can actually, either be an advocate for you, or you got to speak up for yourself. You can't just say, well, because as a professor, I just put my head down and move on. But when it becomes your colleague or classmate, now we have to, speak up. That doesn't make any sense. Now we're just talking double step here, and I don't know. It just makes no sense. Just listen to this conversation right now.
If I can
it's survival.
I think
one
thing to that, exactly. It's survival. Because at the end of the day, right, your classmate, it doesn't matter what happens to them. 4 years after, you may never see these people again. You'll have your friends, and you'll go on. right? But if this is faculty, right, who knows? You need letters of recommendations to get to the next level, to find jobs, to find residency. In my case, I'm in New York, so, if we want to work here, we need residency. We don't have a chance at a good one without good letters of rec, right? And who knows? And I was a D1 when this happened, so I don't know the kind of networks that these professors have. So if I go in causing a ruckus, me as a 6-foot black guy, I wear earrings, you know what I mean? Now, I'm professional, but, there's still stereotypes that I do kind of fit. If I now start bringing that energy to Dr. Lieberman or whoever, that's trouble for me, So I think it is survival. It's about playing smart,
Such a great discussion. We will continue discussion in part 2. Stay tuned.